Hey everyone, we all know that diet can play a role in acne, but did you know there are several science-backed vitamins and minerals that can be helpful in the treatment of acne? I'm John Barbieri, a board-certified dermatologist and acne expert. In this video, I want to separate the science from the hype when it comes to vitamins and minerals in the treatment of acne. Let's dive into the data. Since vitamin D is known to play a role in immune function, there's been interest in whether vitamin D might influence the inflammation that we can see in acne. Interestingly, if you just look at vitamin D levels among people with acne, those who have acne have lower vitamin D levels than those who don't, and as acne gets more severe, those vitamin levels get less and less. Together, these kind of evidence suggests that vitamin D might play an important role in acne. These factors led Lim and colleagues to evaluate whether vitamin D might be an effective treatment for acne. They did this using something called a randomized controlled trial, and in this, patients with acne received either vitamin D or a placebo, essentially nothing. This allows us to isolate the effect of vitamin D from everything else that might be going on. In this randomized controlled trial, Lim and colleagues found that those who got vitamin D had a 35% reduction in acne compared to just a 5% reduction among those who received placebo. So this evidence really supports that vitamin D might be a helpful treatment for acne. And notably, the dose was a very normal standard dose, just 1,000 international units per day. So I think vitamin D is a very reasonable thing to consider as a treatment for acne. Similarly, zinc is also thought to play an important role in our immune health, and thus it might be a helpful treatment for acne. In fact, there have been 15 randomized controlled trials examining whether zinc might be useful as a treatment for acne. In general, most of these trials have supported that zinc can be a helpful treatment for acne. However, in general, these studies have required very high doses of zinc, 30 to 135 milligrams of elemental zinc per day. And a challenge is that these doses, they tend to cause a lot of stomach upset or other issues from a side effect standpoint, so they're not as useful when it comes to treating acne. Pores getting clogged, which is caused by how those skin cells or keratinocytes grow up in our skin, is another key factor in the development of acne. Since vitamin A and vitamin B5 play a role in how our skin cells, how our keratinocytes develop, there's been interest in whether these could help with acne as well. To examine whether vitamin B5 might be a helpful treatment for acne, Yang and colleagues conducted a randomized controlled trial where they took patients with acne and they had them take either a vitamin B5 supplement containing 2.2 grams of vitamin B5 pantothenic acid or a placebo. And what they found in the study was that those who got the vitamin B supplement, they had a 40% chance of having clear skin compared to just about 15% in the group that got placebo. Those who got vitamin B5 had a 70% greater reduction in their pimple counts, and they had greater improvements in quality of life. Together, these findings suggest that vitamin B5 can be a helpful treatment for acne. It is important, however, to note that this is a pretty high dose. 2.2 grams per day is a lot higher than the recommended daily allowance of vitamin B5. However, vitamin B5 is a water-soluble vitamin. That means when we have too much of it, we tend to just pee it out. And in the clinical trial, and just in our general clinical experience, it seems like doses as high can be safe. There weren't any side effects that were observed in this clinical study. Now, what about vitamin A? We know that isotretinoin Accutane, which is a vitamin A derivative, is one of the most effective treatments we have for acne. So could vitamin A be potentially something that could also work for acne? There are some that even suggested we use it as an alternative to isotretinoin, to Accutane, when we treat patients with acne. What's important to note here is that vitamin A is a fat-soluble vitamin. That means that it can get accumulated in our body over time. And the doses that you need to treat acne with vitamin A are very, very high doses. And at these doses, it's very difficult, if not impossible, to avoid serious side effects and risks. And so from my standpoint, I don't recommend taking vitamin A as a treatment strategy for acne. It's just too risky. There's too much potential for serious side effects that can happen at the high doses that you need to treat acne. So let's put it all together. If I were someone who is interested in vitamins or minerals in the treatment of acne, I think vitamin D is a very good place to start. Vitamin D, 1,000 international units per day, that's a pretty standard dose. It's not some sort of mega dose. There's randomized controlled trials to show that it can be helpful for acne, especially for more inflammatory acne, those deeper pimple bumps. And so for me, that's a very reasonable place to start. The next thing I think about would be vitamin B5, somewhere in the 1 to 2 grams per day range. Now this again is a higher dose than what the recommended daily allowance is for vitamin B5, but it does seem like this dose can be used safely. It's a water-soluble vitamin, so when we have excess of it, we tend to just pee it out. And again, there's randomized controlled trials that support that this can work for acne and that it can be used safely in the treatment of acne. Next, I think zinc is something that's worth considering. It certainly can be helpful for acne, but it does tend to require higher doses where people often experience stomach upset. For instance, it often takes about 400 to 600 milligrams of zinc sulfate or 200 to 400 milligrams of zinc gluconate for it to be effective, and these are pretty high doses. Now, if you're someone who can tolerate those high doses of zinc, it certainly is something that has been shown to be potentially helpful for acne, but for many, it's something that just comes with too much side effects to be worth it. And then finally, I'd avoid vitamin A in the treatment of acne. I just think that the potential serious side effects that come with it just are not worth the potential benefit that it could have in acne. Finally, I want to highlight a common theme that's kind of permeated this discussion is the importance of randomized controlled trials. For every single vitamin or mineral that I've recommended in this video, there's been a randomized controlled trial that supports that it can work and that it can be safe in the treatment of acne. And now, why is this so important here? Well, when it comes to nutrition and diet and health, it's very hard to separate the nutritional and dietary factors from everything else that might go along with that. We call this issue confounding, where there's some third factor that's leading to a spurious link between two things, where there's not a real association between them. For instance, imagine that people who like to spend time outdoors and exercise, that they're going to have higher levels of vitamin D because they're out in the sun, and maybe they have less acne because they're living a healthy lifestyle. Well, if we just looked at vitamin D and acne alone, we might think that the vitamin D is leading to that improvement in acne, when in fact, it's that time spent outdoors and living a healthy lifestyle that's leading to both of those things. And that's really the essence of what confounding is. This is why it feels like every day you see a study that's saying coffee is terrible for you, and the next day there's a study that coffee is great for you. This is this challenge in nutritional epidemiology of separating fact and truth from hype. And that's again why randomized controlled trials are so critical here, because they can help to isolate the effect of a single thing, of that vitamin or mineral, from all those other things that might go along with that in our daily lives. And that's why, again, I think randomized controlled trials are really important when we're thinking about nutritional epidemiology, when we're thinking about the influence of diet and nutrition on our health. If you found this video helpful, give it a like so that we can share it with other people in the community and they too can learn about how they can use vitamins and minerals to help with acne. If you'd like to learn more about acne and rosacea, check out our channel and consider subscribing to stay up to date with the latest content. And in the comments below, ask me a question about acne. See ya.